You planned for their first day of school, their first shoes, their doctor, their health care, and everything else you could think of.
But you never planned for this.
Hello, my name's Kendra, and I'd like to talk to you about pertussis, because adults have the ability to protect infants from this awful and dangerous disease. Pertussis, also known as whooping cough, spreads easily person to person. Pertussis can last for several weeks. Early symptoms include runny nose, sneezing, a low-grade fever, and a mild occasional cough. Typically, children develop severe spasms of hacking or whooping and vomiting mucus after coughing that can last for weeks. There are often 5,000 to 7,000 cases in children each year nationally, with some resulting in death. Most deaths occur among those not vaccinated, those incompletely vaccinated, or among children who are too young to receive the vaccine. The sounds of an infant or a child with whooping cough are unforgettable. Listen to Jennifer Lopez on the sounds of pertussis. Most infants with pertussis get it from their parents. Though pertussis is most dangerous in infants, both adults and teenagers are at risk of this disease, mostly because their childhood immunizations have weakened. Their cough is usually different, no whoop, but a dry and nagging cough that goes on and on and on for over 2 weeks or more. Many infants who get pertussis often catch it from older family members who might not even know they have the disease. Make sure you and your family are vaccinated for pertussis. If symptomatic with a respiratory infection, stay away from infants or wear a mask. Any infant with persistent cough should be evaluated for pertussis. If you or a family member show any symptoms of pertussis, see your physician and get preventative antibiotics for yourself and for those in your home.
2 pharmaceutical companies have developed a vaccine for teenagers and adults up to age 64. We call it Tdap, tetanus, diphtheria, and pertussis vaccines. Who should not get the pertussis vaccine? Anyone who's had a life-threatening allergic reaction after a dose of vaccine with tetanus, diphtheria, or pertussis components. Anyone who's been in a coma or had multiple seizures within 7 days after a dose of these vaccines, unless a cause other than the vaccine was found.
Check with your physician. If epilepsy or other nervous symptom problems occur, including severe swelling or severe pain after a previous dose of any of these vaccines, or a history of Guillain-Barré syndrome. Anyone with any moderate or severe illness should wait until they have recovered, as well as pregnant women until they have delivered to receive the vaccination. If you are close to delivery date and have a respiratory infection with a cough, remind your doctor. Ask if you should be tested for pertussis. You may need antibiotics. You may also need to wear a mask during delivery. If you have a cough and/or a respiratory infection, request a mask to wear around the baby. Ask the doctor if you should be tested for pertussis. The test is a simple nasal swab. Treatment is with antibiotics. Request that family members who have symptoms either wear masks or do not visit until they have recovered. How can you get the adult pertussis vaccination? If you are eligible, your doctor may be able to provide the vaccine. If you have health insurance, your doctor's office will be able to determine whether or not the vaccine will be covered. Branch-Hillsdale-St.Joseph community health agencies have vaccines designated for those who do not have health insurance and cannot afford the shot. Check your current vaccination status. If it has been 2 or more years since your last tetanus shot, you may receive the one-time dose of adult pertussis vaccine, or Tdap. When you are eligible for your next tetanus shot, a booster after every 10 years, resume your normal tetanus vaccination. Remember, parents, grandparents, aunts, uncles, teenagers. One vaccination can protect the babies in your life from a life-threatening disease.